welcome to the Vocal Dental Nurses with your hosts, Kate and Shelly.
We'll do it after.
Yes.
You still hear me?
Welcome everybody. You might have heard some little whisperings about some can I have some food? And yes, she can talk, because you've probably gathered that it's Shelly and Kate again, and we've got the wonderful daughter, but she's probably hiding in the corner, I think, Shelly, isn't she?
She's been banished
come
to
and
the
say
corner.
A quick hello again?
No,
oh, bless
I'm not encouraging her because then she won't leave my side. But if anyone can hear Minecraft going off, that's what she's doing. Hopefully.
And meanwhile, Shelly and I are going to use this time again, just have a little chit chat about dental nurses, how fantastic they are, and in some cases how not valued they are, which is a real shame. But I think today, Shelly, we're going to talk about the varied roles and responsibilities of a dental nurse, aren't we?
We are, yes.
Yeah. Little nod of your head.
Yes, we are.
So, I mean, I suppose even within your practice, Shelley, I mean, I know what you guys do. Obviously, I don't know full time, but I mean, it's such a varied position, isn't it, being a dental nurse?
Yeah, 100%. And people still believe, you have the trainees, bless them, come for an interview, and you sort of, one of the questions is always, and what do you think the roles and responsibilities of a dental nurse are? And it's like passing the dentist equipment, welcoming the patient. It's the tip of the iceberg, isn't it? It really is just the tip of the iceberg. If it was just that, even that's, enough to do, isn't it, really? But yeah, the list is just endless, absolutely endless. And it's not just, like we've said before, it's not just what people see in surgery. It's all the stuff behind the scenes. It's all the decon side. The paperwork side is just relentless. The policies, the tick lists that go on forever. Has this been done? Has this been done? Yeah. Your
stock control, I think.
Yeah.
No, I think a lot of people don't appreciate, it isn't just a matter of going and getting some stock and replenishing your surgery. And I mean, I think I can talk for most dental nurses out there, maybe, that, you've always got one nurse maybe in the practice that would rather go to another surgery perhaps and borrow something from the surgery than go into the stock room. So when you go to your surgery and you think it's all stocked and your dentist asks for something, it's not there. Yes. So stock control is a massive thing within a practice, not just within the surgery, because obviously somebody's got that role and responsibility of the stock room as well. Yeah. And it certainly doesn't always fall to a head nurse, because I know a head nurse sometimes delegates that to a member of a team. But with all the roles that a dental nurse has, I don't really hear many nurses say that they're actually given additional time to complete these roles. I mean, this is normally within a 5-day week or a 6-day week and a 9 to 5. Yeah. So it's not as though they have spare time. Yeah. They're nursing those 5 or 6 days, aren't they?
Yeah, 100%. So we're quite lucky at our place. We get a 45-minute setup time in the morning. I know a lot of places only sort of get 10, 15 minutes, but those 45 minutes are manic, making sure everything's ready. We have to check all the day lists, check that the lab work's ready for, if you've got any crowns or denture work in that day. He likes us to check and write down when the last time was that they had bite wings, and then put a little reminder on if he's due to take those, making sure all the lines have been run through, decon's all set up. You've got everything that you're going to need that day. And then, the last job on the list is a cup of tea waiting for him when he comes through the door.
The most important job.
But the last one. So it's nice and hot when he arrives.
Oh, I can only imagine, because I know who you're talking about. But we all love him.
Yeah, he loves his tea, bless him. So, and we're really lucky in that respect that we do get those 45 minutes, and they are needed and they are used.
Oh, yeah. They are. But do you know what, Shelley? It's fantastic. And I absolutely understand that word in that sentence, manic, because it isn't a 45-minute leisurely stroll and check, because then you potentially got somebody coming to you saying, I can't find certain piece of lab work, or I can't find. So you're almost sort of working as a team, but helping other people as well.
Yeah.
But during that day, what you've just said a moment ago as well. So not only chairside assisting that dentist with everything, looking after the patient, answering any questions. You've just said it's all those tick lists,
yes,
all those logs.
Yes.
And it's not as though you can say, oh, I might fill that in later, because you're only going to build up throughout the day all the things you've got to tick off and check. And it's, I mean, how on earth would you explain that in an interview without putting them
off for life? Yeah, it's yes. We try not to. We're very it's assisting the dentist and chatting to the patients. Yes, no. We break them in gently.
Not at all.
We break them in very, very gently.
Yeah.
Because it is too much to put on someone. I mean, when we had our first webinar some weeks ago now with Ree, I remember saying on my first day, I remember sitting in surgery thinking, I'm never going to get this. I'm never going to get this. So to throw everything else on top, it would just blow people's minds. So it is, you do have to sort of take it gradually and start,
100%.
every day or every week, start, introducing other bits that we are eventually going to expect from them as a dental nurse.
Yeah.
But it's a lot. It is a lot.
I mean, it is. And I mean, with the skill set that a nurse has, I mean, the organisation skills, how they empathise, all of those things, that they're almost underrated. And I mean, it's a massive part of the job. Not just to emphasise with the nurses, with the patients, is to emphasise with your team.
Absolutely. My biggest thing whenever anybody comes for an interview, whether they're qualified or they are brand new to it all, is that you have to be efficient and you have to be obsessed with cleaning an organisation, because those for me are the biggest foundations. You have to be logical, efficient. Your time management has got to be,
A1.
It really has, because otherwise you've got that much to do. If you don't have a set routine, you can just forget it, because it'll all just disappear. You'll forget. So I like to have set routines. I do things at certain times of the day, and then I know that they're done then.
100%.
Rather than leaving it all to the end and then thinking, where do I start now?
Exactly, because bear in mind, at the end of the day, you've got all those other processes to follow for a close down, shut down of your surgery. And potentially, you obviously got to be keeping an eye on the rest of your week, the next day, checking that you've got everything there for that day's work as well. So, I mean, it is endless. I mean, there's not a position within a dental nurse's role for somebody that's lazy, because you really are on the go 100%. And I mean, we're missing a massive part of their role as well, which is there to chaperone their dentist, their hygienist, etc., etc. They are there as a chaperone,
which is
a massive and important role, isn't it? So note taking. I mean, they've got to be absolutely spot on with the note taking. And as you know, all these things we're mentioning, they don't just happen. If we've got a patient in, that just doesn't happen. One, and then we do that, and then two, and then note taking. All of these things, the dentist wants that, the hygienist wants that. You've got to make sure the notes are done. You've got to make sure. So all of those things are happening, sometimes all at one time. So I mean, the pressure a dental nurse can be under is phenomenal. And I mean, I think that's the importance of having a really good team around you, much like yours.
Absolutely. The team really do. It's like if ever we've got a dentist off on holiday, or if they call in sick, which luckily very rarely happens. I mean, when I started almost 20 years ago, that would be like, oh, brilliant. I'll sit in my surgery and I'll empty out all the drawers and I'll do this. And It doesn't happen now. It's like you are in that decon room, you're making bite packs, you're checking the surgical trays have got everything on that they should have. You're doing all the different jobs in there. We make our own bite guards and whitening trays. So there's always something to do. I mean, it is just relentless.
Yeah.
Absolutely
100%. And I think, like what you've said right at the beginning earlier, it's the things that you don't see that are so important for the daily running of a surgery. But of course, you don't see them because it's not done perhaps in front of the patient or in that surgery. Because as you've said, you know, it's often carried out in decon. And I mean, I feel, you know, very strongly about the position of a dental nurse within the practice. And for me, personally, it's only my opinion, but hygienists, when I hear that hygienists aren't supported by a dental nurse, I can't understand why they aren't. You know, it's my personal opinion, but I think that it's really important that they are supported wholeheartedly. I do.
Absolutely. At our place, they only get 20 minutes as well per patient. So if ever they were left on their own, it's a real struggle for them. I mean, we do have days if we're short, you know, they have, it's awful, and it is awful. But the good thing is all the girls are made aware in the morning, so-and-so's without a nurse today, so they will run up, get the trays for them. But still, it's, you know, it's not an ideal situation, is it?
No, absolutely. But you've got to do what you can do within a practice. And you're right. And if your team's aware of that we're going to be short-staffed, you know, it's lovely to see a team work like that. And I suppose the other position, which I commonly hear, is a decon nurse. So if you're fortunate enough in a practice to have a decon nurse. I know. They're those other gold framed, wonderful people.
They really are.
That's another position that obviously gets pulled because obviously if you're short staffed.
That's always the first to come out. Decon is always the 100%. First. Which is a real shame.
When we talk, it is, because the pressure it puts back on the team is phenomenal. But you know what, like when we talk about decon, it's quite a throwaway thing for us to just say, someone's in decon, or there's a lot of work that goes on in decon. For those people, to be fair, that aren't aware of, you know, they've got an idea that's where, you know, the decontamination is carried out with the instruments, etc. How many instruments you have in a practice. And by that, I mean, I know that obviously you guys do implants. So we're talking here, different autoclaves. So some are vacuumed, some are non-vacuumed. We all know what you can and can't do with some of the implant material equipment. So it isn't just there's your autoclave, give them a scrub and put them in. I mean, it's a different level to know things and what can go in and what can't.
Absolutely. I mean, Debbie, our implant lead at our place, is very protective of our implant equipment. So she tends to, that's either...
Big love to Debbie.
Yeah, big up the Debs. So she will always sort out the implant stuff. But again, we've just had a new autoclave and that's got an implant cycle on it. But the cycle that we use every day has got a drying time. Well, we always deactivate the drying time simply because it just takes too long. But when we put it on an implant cycle, you need the drying time. So then we end up having to stick a great big note on it saying, do not disable drying time, implant instruments being processed. And it's just silly things like that.
It is. Yeah, I've been into so many decon rooms, Shelley, and you're so right. Implants going through do not touch. And I love, when I say implants, obviously implant equipment. And it makes me giggle because I think I know, because some people do think they're being helpful and they'll go and deactivate something, which means they've got to go through it again.
So it is. And, you know, it's the thinking ahead all the time, isn't it? And that's another one of my biggest things that I say to all the girls, you know, you're not just in the here and now. You've got to think ahead. Is the dentist talking about possibly doing a composite filling? Get your stuff out the drawer. Are they chatting about treatment that they're going to need a bit further down the line? Get it on the plan so estimates can be printed out. You know, it's that you've got to be one step ahead all the time.
You have. And I mean, exactly what you've just said, Shelley, time management. So just briefly going back to even just using the autoclaves, you girls and boys as dental nurses, the importance of your appointment book as well, because if you, for example, back-to-back implants, or if you've got back-to-back fillings, or if you have got to be aware of that process time in the decon. Absolutely. Because if not, you've got a dentist and a patient waiting. And again, you know, that's another role and responsibility, massive responsibility on the dental nurse, because as you've said, you look through your day list, I dare say it's a couple of days beforehand to have a look, because if you're identifying treatments that are back to back like that, there's potential problems before you've even approached the day.
Absolutely. Yeah, absolutely. And this is what helps. I mean, in our practice, the girls rotate. So like you mentioned earlier about stock, people borrowing stock from other surgeries. Yes, it does happen. But luckily, because we do all rotate, no one surgery sort of gets left in a state, because there's always someone, you know, someone different going around. But equally, the girls rotate on reception as well. And I do think that helps that they've got a clinical background, because they are then aware, oh, someone's already booked in for implant surgery there. Would it be wise to book one straight in after? Can the girls get the stuff through? So that, you know, that really helps, that the reception team are aware of what happens in surgery.
Massive. I totally agree with you. And I mean, throughout dentistry as well, you know, for them to realise what they're putting next, you know, pop an examination in, or a consultation, or, you know, an impression. Because much like your practice, loads of practices out there, and this is going back to when we were talking to Ree the other week, the nurses have got extended duties, you know, and skill sets. So, you know, some of them can take impressions and x-rays, etc., etc., etc. But with that comes more responsibility as well, which is fantastic. It's lovely to hear that dental nurses have got other things that they can branch out to do. But of course, that does bring another layer of, like you said, paperwork and tick lists, and it is endless, isn't it?
Absolutely.
Endless.
Yeah, absolutely. So yes, as long as you're well organised,
are you ever
efficient, team player, you love to clean.
Love to clean, like love to clean.
You have to.
There's those different. You do, because there's a different level of loving to clean, because we're not just talking in your kitchen at home and making sure it's clean. We are talking it's got to be sterile. You know, 100%. This is a different level. So one person's clean to another person's clean can be quite different.
Yes, there is a spectrum. There is a spectrum.
Very polite, you know. There it is. Tell just something different, because I know where it is in your practice. So you've got a milling machine, haven't you?
We do, yes.
Yeah. So I mean, with that milling machine, what sort of care for that actual machine? You know, we've got an idea of what it does. But how do you look after it? I mean, cleaning it out, and I mean, that's got to be done.
Yeah, that's so after every use, the water chambers have to be emptied. It all has to be wiped around inside after every single use. And then weekly, we have this, it comes with a great big, what looks like a briefcase, and there's like little TP brushes in there, wire brushes in there, bits of oil. Certain parts have to be taken out and re-oiled. We have to run cycles with a cleaning fluid going through. So that's just great stuff. And
that's sort of, it's another thing to do, if you know what I mean. It isn't a 2-minute job, you know. So something else to take on. And of course, the maintenance of the equipment, I suppose, is where I'm going with this, is often, obviously, carried out by dental nurses. And I don't just mean by oiling the hand pieces or using things like that. It's a general maintenance of what you see in the surgery. And looking after it.
Yeah, 100%. Again, that comes back to our tick lists. We've got a delay. I lost you for a minute there. Tick lists. We've got, you know, tick lists for decon, tick lists for end of day shutdown, tick lists for the start of the day. But yeah, this week we've had to send off our second ultrasonic for its 12-monthly validation. So we're down to one ultrasonic in a 6 surgery practice, and that's just chaos. You can just see the trays racking up. So stuff like that. It's and then of course our brand new autoclave, whereas our old one, it's just a case of, you know, checking it's reaching the correct temperature and the holding time and all that, checking the door seal, wiping it inside and out. This one has to have 2 daily cycles run before you can even use it to check that the air chamber's working correctly. And honestly, so all that needs doing first thing before you can even start calling the patients through. So it's just, yeah.
Do you know, I mean, just going back on the things that we've just said. So like that 45 minutes, for example, for you. And as you've said, you know, there's people that may have a bit more. There may be some practices that have less or none. I don't know how they'd have none, but, you know, there are some.
It happens, yeah.
All of those things. Yeah. And all of those things that have got to be done prior to having that bum on a seat is phenomenal. Absolutely phenomenal. And I mean, over the last, you know, sort of 5 to 10 years, maybe, I mean, it's just got bigger and bigger, especially the tick lists. The paperwork is what I hear most people. When I say complain about, I don't think complain's the right word, but certainly it's an issue because, as I've said earlier, they don't have additional time to do that kind of thing, but it's got to be done. You know, it's got to be done.
And I think for some of us that feels...
as a head nurse...
Yeah, go on. Yeah, what was I going to say? So I suppose for some of us, these tick lists and all this paperwork, it can sometimes feel like it's taking you away from what you originally signed up for, which is to be chairside. But it's one of those, isn't it? It's, you know, that's what needs to be done. So you have to just get on and find the time to do it, unfortunately. And I mean, I you know, I always bring it back to having a good team, you know, good clinical team as well, because I mean, I keep saying it, much like yours and the other practices that we've been in, it's evident when you have got that strong team support, because, you know, you do have people coming in to grab your decon. You have got somebody in checking that you've got that or your tick list. Or so rather than years and years ago, you kind of felt a bit isolated in your surgery and that was it. But I think the realization of the amount of work that needs to be done now within the dental nurse role, you need your team. Absolutely. 100%. It's like if we don't have a decon nurse, which we very rarely do, whoever goes into decon, if they're bringing their tray of dirty instruments down, if there's already a tray waiting to go into the ultrasonic or through the autoclave, we will always sort that out first. It's not just each man for themselves. It's, you know, that was already there first. I'll put that through. And that's how it's got to be, because we are a team. And ultimately, yes, this stuff needs doing, but it needs doing because we need to take the best care that we can for our patients. So 100%. Even something as silly as, oh, those have been sat there for, they're not my instruments, I shan't bother with those. That's not helping the practice as a whole.
No.
So it's
100%.
Teamwork, and you have to trust your team. You have to trust that if you're out the way in surgery for a couple of hours doing implants, you have to trust that what they're doing is, you know, working for a start,
of course,
and you know, helping out where they're needed, which our girls do. Thank goodness, we have a really strong team. You
do, I must admit, I can vouch for that. And I suppose the other thing as well, Shelley, with you saying that you rotate, so it means that you have clinical awareness, if you like, on reception. That's priceless in itself, because bear in mind, part of that role of a dental nurse as well, and you know, we do accept that it is different in practices. So we're not saying that this is the role of a dental nurse, but this is our experience. So when a patient's got a question, you know, the questions are quite often over the phone or via email, and that is to your reception team or your nurses. So you've got to look after those questions as well. So I think what you've got in a practice, that's brilliant, because if you've got that clinical knowledge on reception, that doesn't always leave it for the dental nurse that day, if that makes sense. So I think having the clinical knowledge on reception helps in so many ways.
Help. Yeah, definitely. I mean, we've got one of our girls, Maeve, bless our Maeve. She only does 2 days a week. She's been there since the dawn of time. But I heard her this week say to a patient on the phone, just bear with me, I need to go and speak to a clinical member of the team. And she came off and spoke to so-and-so who was sat on the desk and said, can you just da-da-da-da-da-da, and then went back. So, you know, it helps, definitely. Otherwise, you would then have to go and disrupt somebody in surgery and potentially have to phone that patient back, you know, a couple of hours later, you know.
And it's adding, and that's exactly what I mean. So that dental nurse that's actually actively in surgery at the end of the day may have 4, 5, 6, 7, 8 queries, phone calls, questions to answer. So I think to be able to have that within your team and rotate, you know, it's working as a team, I suppose. Again, that's absolutely that's another way to look at it, isn't it? Well, I hope we haven't really put people off being a dental nurse, Shelley.
No, I know. It sounds dreadful, doesn't it?
Do you know what? It sounds dreadful, but I think it's important for folk out there just to have a snippet of an idea of what the roles and responsibilities are of a dental nurse, because, as you say, much of it is not seen. But what a rewarding role it can be.
Absolutely, and that's why we do it.
It's 100%, 100%, 100%. And I mean, as you know, there's a patient within your practice that made something for us. And honestly, it's one of the most treasured things I think I've got. I used it this morning. We had a cup made us, everybody, an absolutely beautiful cup with all our names on the handles. And, you know, we don't do it for things like that. But what a lovely, lovely thing for us all to receive. It is a rewarding job.
It is a rewarding job. Yeah, definitely. And I know this sounds terrible working in a dental practice, but Christmas time and patients bring in boxes of mince pies, or they'll go and pick up a tub of chocolates, you know, just silly things. And you think, oh, that's, you know, that's lovely. It's just, it is rewarding. Very, very rewarding. Good job as well, isn't it, really?
Oh, it is. We had, gosh, this is something. It is, yes. Yeah, it is. We had a patient, God, this is years and years and years ago when I was in my practice. And every year she works in a baker's, a well-known one where I live. And she used to bring us a massive box of homemade mince pies. And she didn't need to, but she always said every year, it's just a little token, just say thank you for looking after me. And it, you know, it's lovely, really, really sweet. And we'd rush upstairs and get all the mince pies.
Kettle on.
Put the kettle on and eat them.
Yeah, we usually send notes round. Oh, there's such and such upstairs in the staff room, and you see everyone like, boom, they're gone.
Like a Hoover's been through the staff room.
They're gone. They're gone.
Do you know what we used to do in our practice? You know, much like yourself, you know, we had some very, very generous, kind and considerate patients. So we were inundated with, like you say, Christmas, biscuits, chocolates, blah, blah, blah. But what some of our practice members used to do, the little monkeys, so we'd eat we'd opened a box of chocolates, but then there's not perhaps ones that they liked in there. So they'd open another box. And they do the same with biscuits, and the biscuits would go soft. So we even got to the extent that we locked all the others away and would get one box out at a time.
It's a good idea, because especially for us poor part-timers, you think, oh, there's a tub of roses there, I'll have me a nice hazelnut whirl. But of course, the nutty ones are always the first ones to go. You're left with the fudge. So I might implement that this year, Kate. That's a good idea. The girls better watch out. I'm really locking up those biscuits.
Tell you what, that's me off Beauty's Christmas card list now. Oh, bless you.
It's true that there's nothing worse is that getting yourself all excited when you see this shiny new tub, and it's like, no, it's already been ravaged. It's only been in the building 10 minutes.
Yes, and more often than not, it was with biscuits, because they don't always put the lids back on because people weren't popping up and down. Yeah. But if that's left, the biscuits go stale.
Yeah. Oh, it's so disappointing, isn't it?
Christmas presents and military. Well, do you know what? On that note, hopefully we haven't put people off. We've said this before, guys. Shelly and I are here. We love to chew the fat about anything and everything to do within dentistry, especially dental nurses. We've got some guests coming up over the next couple of weeks. So honestly, if you're a little bit shy, a little bit timid, grab one of your workmates and come and join us. We don't bite. You can see we just want to have a general chit chat. So from me, I'm going to say see you later. And Shelly.
Yeah.
We shall look forward to seeing you next week, young lady.
Yes, absolutely. Thank you, everybody.
Take care.
Take care. Bye.
Bye.